Welcome to the United Way Difference, a program that discusses Oshkosh community needs and how local nonprofit agencies are supporting people in our area. United Way's focus in the areas of income, education, health, and volunteerism helps to build a stronger, more caring, and compassionate community. The United Way Difference is brought to you by the Oshkosh Area United Way.
Welcome and thank you for coming.
Happy to be here.
I'm glad to have you. Julia, you and I have known each other. We've talked about a lot of things over the years, particularly when it comes to affordable health care, making sure that people have insurance, if they can get insurance. But you also then work with the Partnership Community Health Center.
Absolutely.
And that was established in 1997.
Started
in Appleton area,
yep,
right?
In the Appleton area, in the basement of the Salvation Army. We've grown quite a bit since then. I'll tell you how we've grown, but then we're going to focus on Oshkosh here.
Okay, so
Winnebago
let's talk
County.
about how you've grown, and then we'll come in to say, when did you start here in Oshkosh?
Yep. So again, we started in the basement of the Salvation Army. We've grown. We were located in the Goodwill building in Menasha for several years, and last November we outgrew our space and we moved next to our dental center between the mall and the airport in Appleton.
And I remember when you were at the Goodwill Center, because
Yep.
actually you took space that United Way vacated from. That when the United Way of Fox Cities, I think, moved out. I think that's the space that you ended up taking on.
Then I'm sure we made good use of that
Yes,
space
you
for
did.
a number of years. And we had the opportunity to expand and add services, so we needed a little more space in Appleton. Here in Oshkosh, we've been in our dental center for 3 years.
Okay, because you started with dental here first.
Yes, we've had dental here for 3 years. We are located on Westtown Avenue, right across from Menards and Festival Foods, and we've recently added primary care to that same location.
Okay, that's really, really cool. And I know that we had mentioned this a little while ago, but for a number of years, the Oshkosh community did have the Living Healthy Community Free Clinic, but that no longer exists here.
Correct.
So this was, you're filling a definite gap in the community.
We're a healthcare home that has a lot of options for payment for all sizes of families and individuals, and that's going to fill a need for a lot of families here in Oshkosh.
Okay, so what's different? I mean, you're kind of leading into it, but what's really different about Partnership? And I'm gonna shorten it to Partnership, or you guys always call it PCHC, but I'm gonna forget that. So we're gonna call it Partnership. What's different about Partnership than other health centers?
So the part that you don't like to say every time, and I understand, is the community health center. And what makes a community health center different is that we are here to serve all people, regardless of their insurance status. So we provide several options for accessing care. We accept Badger Care. If you have the Forward Health Card, you can use that both for primary care and dental care. And that's rare. It's really hard to find a dentist that will accept your Forward Health. You're going to see pictures of our beautiful dental center coming up. We also accept that for our primary care. We also have a sliding fee scale. So based on your household size and your income, you could qualify to pay a smaller copay and percentage of your services on our sliding fee scale. Think of our neighbors and friends who have Medicare, where their medical costs are covered, but they don't have dental coverage with their Medicare. You can still utilize and access dental care on our sliding fee scale.
Okay.
There are people who at some point in the year might fall in a gap where they don't have access to insurance. Again, our sliding fee scale means that you don't lose access to care.
Okay. Well, you had mentioned those photos, and I was to your grand opening 3 years already?
Yes.
Yeah, 3 years ago. And so let's walk us through the photos.
You bet.
As soon as they come up, there we go.
Yep.
So you're
There we
located
are.
near Menards, near Culver's, near Community First Credit Union out on the west side.
Across the street from Menards and Festival Foods, in between Culver's and the Verizon store, and Papa Murphy's Pizza is on the end of our building. We're a little hard to see. We have a sandwich board out on the street. And you will see that it does say Partnership Dental, but we now do offer medical services in that same location.
Okay, and your lobby.
Beautiful lobby. It's a beautiful state-of-the-art facility. We have 10 operatories. We have dental hygienists. We have the 4 dentists on staff. We do a variety of services. And in that space, we carved out 2 medical suites. So we're also able to have a nurse practitioner there 2 days a week to provide preventive care and medical services.
What I like about it, too, is you have a wonderful lobby.
Lots of light.
Lots of light.
Clean, beautiful, nice space, enough room for families to come in. What we're not seeing here is a little kids play area and some toys. So kids are always have something to keep busy. It's a beautiful place.
And then we have one dental operatory, a photo of one of the dental operatories. But, and you know, most people that go to a dentist, you'll know this pretty much looks like a dentist's office. But you also have one location where people who maybe are in wheelchairs can also get.
We do.
That's what I remember most, is
And,
that you
and
have
that's
your
also
handicap
good for
accessible.
a sensory quiet room as well,
Okay.
because it does have a door that can shut. So the chair itself, you can put a wheelchair in and it will tip if you're not able to get out of your chair.
Right.
But it's also a place where we can bring people who need a quiet space.
Okay.
Someone who might have a little anxiety about being at the dentist and prefer a quiet space. So
That's right, because now that I'm thinking about it, is there are no doors on the other operatories
right.
because people keep coming in and out.
exactly. That aids the flow, and there's always background music and there's ambient things. So you really can't hear discussions
No.
from operatory to operatory.
No, they're private.
They are private. Yeah. I will assure you that the medical suites have doors.
That would be a good thing. Yeah, that's a good thing.
You can
to
shut
know.
the door in there.
And I think I know where you put those, because when I was there one time, you guys were showing me where they were going to go.
Yep.
So you did talk about accepting Badger Care in most commercial insurances and having that sliding fee scale for people that might not have insurance, and then based on their household size.
Right.
So
And I'm going to give you another example
Okay.
of when that sliding fee scale works. Is there are people who have insurance with really high deductibles.
Okay.
You can still utilize our sliding fee scale, pay a lower copay, and then your costs actually reduce your plan's deductible and out-of-pocket costs.
okay.
That's something that a lot of people don't know. You can utilize our sliding fee scale when you have insurance.
Okay, so then you're still paying down your deductible.
It does.
And ultimately, if you need to have that big thing done, your deductible may be to a point where it would be covered then.
Yep, yep.
Okay, but you still, I mean, people are always going to have out-of-pocket costs.
There are often out-of-pocket costs, not so much with Badger Care,
That's true.
but when you have insurance or private insurance, yes.
Okay. And maybe you don't know the answer to this, but you probably do, is, you know, do you know the number, and maybe it's coming up, do you know the number of people who see you with private insurance as opposed to Badger Care? Is there like a 50-50? Is it a...
You're right, I don't know that number.
Okay. I'm
But-
just kind of curious.
But I'll tell you, having access to dental care with Forward Health or Badger Care is unique in our community. There's not a lot of access for people who have Forward Health, and a lot of children have Forward Health because they include a much higher income range for children. So we do a lot of kids. Your kids should be getting their sealants, their fluoride, their cleanings. So we see a lot of kids. We see a lot of adults as well who are on Badger Care or paying on the sliding fee scale.
Well, and you know, our United Way helps to fund the Tri-County Dental Clinic as well, and that mobile clinic that comes into town is hopefully getting many of those kids, and so hopefully you'll see fewer children and then be able to really focus your attention on those adults, but that's not always the case.
Well, we'll see anybody. We're
Right.
happy to see anybody,
Right.
No matter what stage of life you are. And I'll tell you, I have been located now since we've opened up our primary care in an office where I can hear what's going on in the dental operatories just slightly. The care and the consideration that they give to their patients, no matter where your journey is with your oral health or if you have anxiety or concerns, I am so impressed with how we treat our patients.
That's
It's
good.
nice to hear. You can just hear it walking by the rooms.
That they take time with them, that
Absolutely.
okay, that they understand what's going to be happening, all the procedures.
They allay any concerns. They're teaching oral health best practices to patients while they're in the chair. There's no shaming or judgment. It's a really wonderful environment to be getting care in.
Oh, that's good. You know, earlier we talked about building those relationships with either a primary care or having kind of a medical home.
Right.
Do you want to talk a little bit more about that? Because what's unique about this, I mean, I'm thinking about myself. I mean, I have a medical home, you know,
Yep.
I'm fortunate to have the insurance, but my dental care and my physical care, health care, are two different places.
Right, right. And here's a good example. I was talking to a young man in the lobby the other day who had brought his mother who had a dental appointment. He's in that 20 to 30 age range where he feels healthy now, doesn't have a primary care doctor established. he has a family history of some things that he should maybe keep an eye on. I said, why don't you come back and meet Jill, and we'll take your blood pressure today. And we talked about the relationship building of having an established provider. That if you wake up and after a few days your sore throat doesn't go away, you know who to call to get a strep test. Or you have someone in your back pocket if something happens that you have questions for. Even if you don't have immediate care needs, building a relationship with somebody so you know who to call when you feel poorly is really what we're looking for. So we're a healthcare home. And now that we've got primary care in the same location, we can do teeth to toes in the same place.
I like that.
Yeah.
I mean, that's a good analogy, teeth to toes. If somebody's working with you, let's say for a year, a couple years, and then they need to move to, or they have the opportunity, or they moved away and they're going to be seeing another provider, medical records are easily shared, correct?
Absolutely.
With their permission.
We have electronic records that we can share. It's one of the benefits of being part of a federally qualified health center is that we've got electronic records available.
Okay. If somebody doesn't have insurance, and you know, we're all supposed to have insurance. So if somebody doesn't have insurance, do you have people on staff that can help somebody investigate what insurance is out there that might be available and affordable to them and get them signed up?
Absolutely. So we talk to our own patients about that, and then we are available to the whole community as well.
Okay.
We have a whole insurance enrollment center in Appleton, and then I'm actually doing that work here in Oshkosh.
Well, and I know that because you and I are in conference calls all the time
All the
about
time,
this.
absolutely. So I'm there on the clinic days, Monday, Wednesday, when Jill, our nurse practitioner, is seeing patients, because if somebody comes in uninsured, on our sliding fee scale, I can meet with them as well to plan when we can get you insured in the future. Maybe we can get you on Badger Care right now. Maybe we make plans for the next open enrollment period for Obamacare. Maybe you have an opportunity to get insurance from your employer coming up soon. I will talk to anybody about their health insurance options, get them connected, because having insurance really is the gateway to accessing care. Then you have a payer mode for picking up prescriptions. You can continue getting specialty care. There's some things that within primary care we might have to refer out to. Having insurance is going to protect you from medical debt. So we talk to everybody about insurance.
Okay. If somebody's on Medicare, I know that, or even Medicaid, I suppose. No, Medicare. Can you help them, like, to understand supplements and all those kinds of things as well?
So
or do you not do Medicare?
Medicare is best handled by the Aging and Disability Resource
Okay.
Center here in Winnebago County. Their benefit counselors are the experts
And they're really
on
good.
Medicare.
Yeah,
Right.
they're really
And can I give you a trick for remembering Medicare and Medicaid? Medicaid is assistance for lower income people who need aid and access to health care. Medicare is for our older citizens or disabled people who need more care.
And I should know that because soon I will be getting Medicare.
Only because you're possibly aging.
I'm
not-
possibly aging, yes. So we're going to go to break in just a little bit. So I don't want to get into anything really heavy, but I think what we'll do is show the graphic about where you're located so that we can just see that.
Yep.
And so that people can actually see where on the map you're located. And that way we'll be able to kind of show us, see right there?
Yep. So first thing is
You have to go
I-
through roundabouts sometimes.
I encourage, yes, that's the thing. I encourage everybody to go slowly through those roundabouts in Oshkosh. When I first started coming down here, you would need to go through 17 roundabouts to get anywhere. So yes, coming through the roundabouts off of Highway 41 onto 21, Westtown Avenue, you make a quick jog there where if you were going to head to Menards or Festival Foods. And again, watch for the Papa Murphy sign. We are attached to that building,
Okay.
and it's harder to see the partnership sign. Make
That's
a
right,
quick
because you're nearest to the highway. You're
Yes,
located nearest to the
we
highway.
are back abuts
Right.
Highway 21.
Right. And the phone number that if somebody would want to make an appointment or even to call for questions is 920-731-7445.
That's to schedule any medical or dental appointment.
Okay, so if people just want to call for information, should they just...
They can call that number as well, and if
Okay.
you have health insurance questions, they'll route you over to our health insurance enrollment department.
Okay, well, we're going to take a quick break, and then when we come back, we're going to be talking a little bit more with Julia about some of the other things that the partnership, or kind of more in detail about what the Partnership Community Health Center does in our community. So thanks, and see you in a little bit.
It's not a charity, it's more than a charity. It's about helping people we live with. It's about being the type of person that the 6-year-old version of ourselves wanted us to be. It's about community and looking out for one another. It's about money, yes, but it's so much more than money. It's about friendship and common values. It's about opening doors when others are slammed shut. It's about giving kids a place to be kids and growing up knowing they live in a community that cares about them. It's about making sure that everyone gets to see the dentist, because we want to make sure that they have every last tooth in those smiles. Ultimately, that's it. It's about the smiles, old smiles and new smiles. It's about us, all of us, our community living united, because great things happen when we live united. Will you join us?
Welcome back to the program. Today I'm talking with Julia Garvey. Julia does the community outreach and community development for the Partnership Community Health Center here in the Oshkosh area, which is a fairly new clinic that opened up in about 3 years ago. So Julia, when we left, we were talking about the fact that you basically can do teeth to toes.
Teeth to toes. I was trying to think of other analogies. Follicles to feet.
I like teeth to toes. It's got a nice ring. But when we're talking about those services, that includes primary health care, but then also dental care. So what's all included in that primary health care? I mean, are there things that you can't do or things that you really specialize in?
Let's talk about things that primary care includes.
Okay.
So management of chronic diseases, certainly diabetes, high blood pressure, the types of, and I have to go back and say I am not a nurse, so I don't have all the language of primary care, but I know that anything that you would meet with a primary care doctor would be to do some preventive care, well woman visits, blood pressure checks, diabetes management, and then things that come up. You might come in with a skin rash, and as we're discussing health with your provider, other things might come up. So back to the point of establishing care with a primary care doctor is really about building relationships so that you can open up conversations about other things that might concern you. Patients have a lot of input, and we have a lot of time to spend with our patients and can really hear what your concerns are.
So you said that you opened up 2 operatories for primary care.
Yep.
So are they the same physicians or nurse practitioners that come every time?
Yep. Right now, Jill Collier is a nurse practitioner. She's been with Partnership for several years. She's worked in the Oshkosh area for quite a while, so she knows the population. She knows the referral services and other health centers if we need to refer to specialty care. We've got a lot of access on the schedule right now, so really on a Monday or Wednesday, you could probably get in on a morning or afternoon appointment.
So are you open 5 days a week?
The health center is open 5 days a week. Our nurse practitioner, Jill, is there Mondays and Wednesdays.
Okay, so Mondays and Wednesdays, and you have availability now. Is she there all day?
She's got opportunities to get in her schedule either morning or afternoons just about all days right now until she starts developing a patient base that's a little more full. So easy access to primary care right now.
That's great.
And to a primary care provider who can spend some time with you. If you've ever been to the doctor and felt rushed, that will not be your experience.
Okay, and because she's the one who's doing it, she will know your medical history. I mean, I know you document everything, but she's familiar with it because she's done the original assessment, and she's probably helping with the treatment plan if there needs to be one.
Oh, sure.
Yeah.
This is the person that you're going to come back to as you're trying out a new blood pressure medication or following up on any procedures or treatments that you've established with Jill.
So now if Jill needs to refer somebody to a specialist, let's say, Jill gets records of everything that happens when you're at that specialist, so when you come back to her, she knows.
She can follow up. Okay. Or, for instance, if you're coming out of a hospital situation and you get referred from your hospital for follow-up with Jill, she'll be able to access those records and communicate with you and see what happened and how to move forward with your treatment plan.
So this really should be a seamless operation.
Yes,
I
absolutely.
shouldn't use the word operation.
Well, and you know, the first thing that happens is that we're going to discuss things. She's going to hear from her patients what's going on, how are you feeling, but then she's also got that behind the scenes, all the records from your healthcare medications that you've been on, and she can follow through with you.
So then what kinds of services do the dental staff provide?
Dental is, again, a full health dental home. We're going to treat all of your oral health needs. A first appointment would look like this. You'd come in and you'd get the full panoramic x-rays and a very thorough exam from the dentist, and then we'll create a dental plan for you.
Well, I just have a question, because not a lot of people have dental insurance.
Again, back to if you have Badger Care, absolutely be coming to the dentist. If you do have dental insurance, we can bill your dental insurance, but then again, we can have you on our sliding fee scale, and you can continue to get care at a much discounted rate.
If you haven't noticed, I keep coming back to this because I want people to know that there is a sliding fee scale, and that's really important.
It is important, and it brings access to a lot of people who think they don't have access to care.
Right, right. So I'm sorry, I sort of interrupted you a little bit, but you said that you start with the full panel, the
Yep.
panoramic panel, and then?
Hygiene, cleaning, fluoride treatments. We do cavity filling restoration and denture work, which is a nice opportunity for people.
That is good. Okay. So how, and I know you're not a nurse, but you probably
And I'm
heard-
not a dentist.
And you're not a dentist, but you probably heard the tie between oral health and physical health. It's huge.
It's huge. This is the gateway to your body. So absolutely oral health is key to all over health, which brings me to a really good point. If you come in with tooth pain and you're a new patient and you've never been before, and it's your hope that day we're going to extract that tooth, we're first going to do a very thorough exam and identify if there's an infection. We want to treat that infection before we start pulling teeth out. It is the gateway to your body, so they spend a lot of time improving your oral health and also asking what medications you're on, because your health affects your oral health. That's another good reason why having that combination of services in the same building is nice.
Yeah, and I think people sometimes don't think about that, oh, you know, well, my teeth, I know I need to get them fixed, but I have this other. Well,
Right.
no, that might be what's causing this other.
Right.
Yeah, okay.
So there are lots of entryways. As you're getting the idea of the services that we offer, people access us at different points, but then can transition to care in other areas. So I've met with people based on their health insurance needs, who then express that they haven't seen a primary care doctor for years, and I can get them in to see Jill. Or people come in for dental appointments first, they don't have insurance, they come talking to me. It's a nice coordination of services in one location.
Okay. Now, it's a lovely location that you have. You are on the west side. What about people that might have difficulty with transportation? I know Oshkosh is a pretty easy place to get around, but some people do have issues with transportation. Is there something that you provide, or that you have a partnership or anything like that with?
And I will say we're right on the bus line. The bus stops right across the street from our driveway, so we're on the bus line. I've seen lots of, Go Transit, that is bringing people in wheelchairs, so we have a lot of access.
Yeah, isn't that great?
It is wonderful, and I've talked to people about their little green cards or brown cards that they have. And
I want to point out the map again,
Yep.
because we showed that in the first half, and I want to show it again now so that people know where you're located.
yep, we're accessible, and remember Papa Murphy's is at the end of our building, and when you pull into our driveway, then you're going to see our partnership sign that lets you know that you're in the right place.
Right, and if you're looking at that map thinking, where the heck is this? Highway 21, Amra Road, so you're going to have Festival Foods and Menards in that general area. You've got
Right across
Culver's
the
in
street
that
from
area.
us.
Yeah,
Exactly.
so, and then we've got the number again, 920-731-7445, if you want to make an appointment.
And I think that your little bottom square then we're talking about transportation. If there's someone who has challenges to transportation or
Right.
barriers, we work with Make the Ride Happen. You can call to find out if you should be connecting to the Medicaid MTM transportation, if you have opportunities through the Go Transit, if they do a really good job of assessing your transportation needs and connecting you to the best route to get to us.
Okay, and Make the Right Happen is provided by Lutheran Social Services, yes?
It is.
Yes, okay. So we talked a little bit earlier about high deductibles, and if somebody has a high deductible, but maybe you could reiterate how that might work. You know, if I have insurance but my deductible is $3,000 to $5,000, I'm probably not going to want to go to the doctor very often because I really can't afford that kind of an out-of-pocket.
Yep, and we see that more and more. Employers are offering insurance that's affordable by the monthly premium, but to use care can be prohibitive. So we do.
But you still need it.
We still need care, absolutely, and we want to get preventive care and not wait until we end up in the emergency room.
But you also still need insurance.
Exactly. So sliding fee scale that we offer based on your household size and income can be used even if you have insurance. You'd pay a smaller copay, meaning we wouldn't go right through your insurance for that copay, but using that care reduces your plan's deductible and out-of-pocket costs.
Okay. Okay, that makes sense. Now, we also work with the Refugee Resettlement Task Force here in the Oshkosh area. So we know that we've had a number of new refugees coming into the area. It's slowed a little bit,
Yeah.
but we still have a number of refugees. They speak many different languages. So what do we do with translation services?
If it's something other than Spanish and Hmong, which we have staff who speak bilingual Spanish and Hmong,
Okay.
we connect with Connecting Cultures for other languages.
Okay. And that's basically a telephone line, a language
It is a
line?
telephone encounter. Sometimes people do come in with family members for translation. Sometimes that's complex, and it depends on if you want your family members to be hearing your private matters.
Right.
But we do absolutely connect with Connecting Cultures via the phone.
Okay. And how long is it to get an appointment? I know that you said that Jill right now has availability, but like for at some point she's going to start to fill up.
Right.
And then maybe we get another person that,
Then we'll
assists
add days.
Jill. Yeah.
So accessing primary care is going to be quick and easy right now. Dental care, new patient appointments, the best time to call to get a new patient appointment would be in the morning. There are sometimes opportunities where a slot hasn't been filled and we might get you in sooner.
Okay.
But calling the 731-7445 in the morning will get you the best access to dental care.
Okay, and they can call that number anytime. It's just
Absolutely.
that for medical appointments, it's only on Mondays and Wednesdays.
Correct.
Okay, dental appointments?
And for medical appointments, you can walk in and see what Jill's schedule's looking
Okay.
at. Or if you're sitting in our lobby waiting for a dental appointment and you think, you know what, my blood pressure, I feel a little strange today. Maybe I'll get my blood pressure checked. Check in to see if Jill is there that day and we can get you in.
Okay. Are you open those same days for dental, or are you open 5 days a week for dental?
5 days a week for dental.
Okay. One last thing before. What's the best thing that you can say about being a patient at the Partnership Community Health Center?
You will be listened to. You will be listened to, and you will be an active part of your care. We will coordinate with you, listen to your concerns at any stage that you come in, and if we want to build on that relationship and continue to assist you in many other ways, but patients feel like they're in a healthcare home.
Well, Julia, you didn't think we'd have enough to talk about
I
to fill a
didn't.
half hour, but look we're running over
It
time.
flew by.
So thank you for being here, and thank you for watching our program. If you need more information, make sure that you dial their number. I'm going to try to do this from memory, 920-731-7445. I knew there was a 5 in it. Thank you again.
Thank you.